Hey, it's Dr. Wonderback, and this is
Dr. Miller.
famous Dr. Miller. What we're going to talk about today is sciatica, and most patients have actually heard or they think they might have that type of condition. What that means is there's nerves in your lumbar spine or your low back spine, and they travel down the leg, and when the pain travels down the leg, it's important information. It's important to know which side of the leg. Is it going to your feet? Is it going to your heel? Is it going to your toes? And which toes? Now, Doc, when we ask them which toes it's going to, what percentage of the patients know which toes it's going to?
You know, it really varies.
Yeah, none of you. So it's okay you're not expecting that question, but it is really important data, because if it's going to only your big toe, that gives us information. If it's only going to your little toe, that gives us information. If it's going to the sole of your foot, that gives us information. And what we try to do is do a very, very thorough consultation. So we can kind of like tell a story, and the story needs to have a beginning, a middle, and an end. So we're going to ask you, when did this thing start? How does it feel? Is it sharp? We want adjectives: sharp, burning, electric. We want to know when you have it. When did it start? What makes it better? What makes it worse? What have you already done? Maybe you've done injections, maybe you've done medication, maybe you've done chiropractic, maybe you've done physical therapy, maybe you've done cold laser, maybe you've done decompression, but maybe that wasn't what you needed, or maybe there's a million reasons. So just because you've tried pain injections doesn't mean that, and it didn't work, doesn't mean that that wasn't the right course of care. It just means that maybe it wasn't done right, or maybe it was done in the wrong spot. Who knows? There's a million reasons that things need to be, but you need a thorough examination. And we have a lot of different practitioners and a lot of different services to help with that. And so, Doc, why don't you roll off some of the services we have?
So we do have decompression. We have cold laser. We have a nurse practitioner. We have different therapeutic injections that she can do. We've got different bracing. We're also a durable medical equipment center. So if you have pressure, let's say, on that lower back nerve and it's going down your leg, if we can decompress that as you're wearing a brace, we have equipment to help with that. We've got TENS units.
We have TENS. We have massage therapy. We have different types of practice. So what we'll always do is we will always start with the least invasive therapy first, because you don't want to start with the most invasive, because if a least invasive therapy worked better, you want to start with the least invasive. Hopefully that makes sense to you, because that's what we're going to prescribe, the most least invasive therapy that we have. And then we have other tools in our toolbox. So if treatment stalls, or you have a failed treatment, or it's not going as well as you thought we could, or we don't think it's going as well as it could, we have different methods to address that, to add on. And what we do in the beginning is we will tell you, in the beginning we're going to get your approval, we're going to get your agreement. Hey, can we tell you everything that you need and tell you what order we're going to do that in? And then we say you can do whatever you want to do, because it's your body. So if you're interested in having a proper diagnosis with an office that everything is done here, not everything, but a lot of things are done here, then give us a call.
301-770-1818.
We look forward to help you.